Hello, I'm Rick Miles. I'm Superintendent of Schools with Scottsbluff, and this is a message for our staff, for our parents, for our community, and a quick summary of our return to school plan, and hopefully help everybody get a basic understanding of where we're headed, knowing that you're really going to have to go to the plan itself to be able to get details and really understand it completely. Why don't we get started? And I think it's important that you start at the beginning very briefly, and you see our guiding principles. Everyone, as well as everyone's needs, ideas, and perspectives must be respected. And that was a principle we initially developed months ago, back in March, when we first faced the closure of school last spring. And then the health and safety of our students and of our staff are our most important priorities. And that's something that is a canned line that you hear in letters and communications, but it's very real. And that's what we know our biggest responsibility is, and that's what we owe parents more than anything at all, and that's what we owe our staff more than anything at all. So those two principles were the overarching guides as we look forward. And then to get anywhere, you got to look at where you want to be. And there were three things we knew we wanted. We want to keep kids healthy and in school. That's our primary purpose. Then we wanted to keep the front line safe. And in a very real way, our staff in the classrooms are exactly who we need to talk to and think about as we make decisions, because ultimately they are the front line. If we don't have our teachers and staff in our schools, we can't keep our schools open. So we know that's critical, and we need to listen to that voice at least as strongly as we do any voice. And then finally, we know that we're a cog in this economy in Western Nebraska. We're a large school district for this part of the state and this part of the region. And we know, with that in mind, we have a tremendous outreach to the regional economy. Many of our parents, many of our kids own businesses, work in businesses that need them to stay open and thrive. And we know that if their kids are in school, they can do that. If their kids aren't in school, many aren't able. We've really put a process together that we wanted to ensure involved a lot of people. That's why we're not the first district to announce a plan. We may not be the last, but we're on that end of things. And we know that kept people waiting. We apologize for that. But I hope you understand, as you look at this list, these are the things that we've done in recent weeks, and we couldn't do them too soon, but we started this process months ago. But we've had about 100 staff members involved in committees. We have worked closely and participated in communications with the Commissioner of Education at Nebraska Department of Education, and the governor's been very involved in those conversations. Every week we talk with Panhandle Public Health multiple times, with formal meetings with superintendents and PPHD each week. Then we've had individual conversations, and we've consulted with people at the hospital, leaders at the hospital, to say, what's your perspective on this? Where do you see the schools in all this? I've had the pleasure of working with about 40 parents in 4 different focus groups, each lasting about 90 minutes, where we really got to talk in depth and go beyond the survey results, which over 1,600 parents filled out. And we only have 3,500 kids. So you start to see it was an incredible response. And about 80% of our staff responded to our survey. And then finally, we had a Board of Education return to school subcommittee that looked in detail at the plan as well. There's a look at the different committees we've had, and you can see we've been hard at work. These committees were put in place in March. They've met regularly. And now as we move forward, they continue to meet even more intensely. And the school committees become even more important as specific plans are put in place for the real logistics, the keys to what kids' days are going to be like each day in school. Wanted you to take a look at Panhandle Public Health, what they're putting out. And if you go to their website, you can see all these things. They're all public. The very back picture identifies Scottsbluff County as yellow. Then you see they're even fine-tuned enough now where Scottsbluff-Gearing is considered a specific community. And then you see the risk dial that's updated each Tuesday so that we can constantly see what's happened and how it's impacted our decision making here at the school and throughout the community. It's also important to say that as we look at that, there's a lot of factors that go into determining that yellow code for the school district and for the community. And those are available to see over at the website too. LaunchNebraska.com has been a major resource. Some of us have been on state committees as well. I was on the Governance and Leadership Committee. Others have participated in different ways and contributed to the decisions. But that again is public, so that's launchne.com, and that advises schools very specifically on what we should be doing. And we use that as a Bible, so to speak, as we make decisions. This was big when it came out. To be honest, we were waiting for some clear direction from the state. It's very difficult when you don't get clarification from the top. What we're supposed to do at the local level, make decisions locally, but we need some clear guidance, common direction from the state. And less than 2 weeks ago, you'll see that this came out. And this is what gave some broad-based guidance to each of the risk levels, from minimal to mild and moderate, where we sit right now, moving up through the orange and then the red. The orange and the red are places we hope we don't go. Orange is a hybrid. That's where they're saying what you're doing now is not being successful. You've got to distance, and in our school district, we don't have room to distance in any other way than to impact attendance. That would mean we only have part of the kids coming at a time, and that's why you see some school districts going to every other day. We don't want to go there. We really don't want to go to red, and that's where we were last spring, and that's when the school facilities were closed. Right now, of course, we're in yellow. We'll talk more about green because green's important to us too, and you'll see we have some contingencies in place. Or actually elementary schools specifically, once we get past Labor Day, if they can keep kids distance and they can keep Mrs. Brown's class with just Mrs. Brown's kids, even at recess and specials, and they are basically self-contained, we know we can contain any spread to at least that classroom, and we might be able to relax some of the precautions that we have in place ordinarily. It's important to mention that the plan we have in place is through September, and we hope it's through September. It could change tomorrow. The way this thing has evolved and the way the guidelines and expectations, the governor's health directives, Panhandle Public Health's advice, on a national level, a state level, a local level, our decisions are only as good as what happens an hour from now. That's why we wanted to wait for the survey, and we did it recently. The data only came in, the survey was only put out earlier this month. So it's not been out very long. But here's what it looked like in broad strokes. The thing that's got to get my attention in my role are those numbers in red. But we've got about 3 in 10 of our parents who are uncomfortable coming back to school. And we've got about 1 in 5 or 85 of our staff members who are uncomfortable coming back. So what can we do? What can we do to help people feel comfortable when they come back to school on August 17th? And that's been so much a part of what we've been working on for the last 3, 4, 5 months. Here's just a real quick look at temperature checks, which came back on verifying what we had thought we'd see. And as you'll see, very relatively small numbers are uncomfortable. That's the orange red there on the right. And the green, light green, that's extremely comfortable and comfortable. And the yellow is neutral. So we had a very small number of staff, small number of parents. You see the total at the bottom of the screen, who were not feeling good about temperature checks. We're going to put that in though, so it doesn't interfere with the school day. We're not going to create backlogs at the front door. We will have enough thermometers where temperature checks can be done in classrooms. It can be done quickly with minimal interruption. And the point there is proactive. we're not going to catch a lot of kids with fever. What the goal is, we keep kids home. That in the morning, if somebody's feeling feverish or they have a small fever, that they stay home, and we want that anyway. We don't want to have a big flu season. We don't want to have a big problem with health anyway. And you know how schools can be in the wintertime. So this is a good thing, and that's how we've looked at everything. When we're going to put expense into something, is this going to help us even when this virus ends and we get to move on with life? Are they good investments in the future? And our absences during the winter have been problematic. And if this is going to help us be proactive in making sure that when kids have a fever, they stay home for a full day after their fever has gone away, then I think we'll go a long way to keeping more kids healthy and in school. Masks. This has been, I can't tell you how many hours we've spent on this topic. It's been the most difficult. I've got my mask here all the time. I'm always ready to put it on whenever I leave the office, whenever I'm somewhere public. I don't like it. I don't think any of us like it. We can't wear this for hours on end, I don't think. Most of us don't like it. Although we know some people get used to it, and emergency responders, people in medicine wear it all the time. Most of us can't do that. You can see my glasses start to fog up. I know I've got to put it over there on my nose so it doesn't. I don't even know if you can hear me talking right now, so I'm going to take it off, but you get the idea. I'm personally not fond of them, and I don't think any of us are. But the split, it couldn't have been closer to 50-50. If you look at the staff numbers, we're at about, 210, 220, somewhere in there, and you add up the uncomfortable and the neutral, or the opposed, and you look at the opposed, it's 123, the neutral's 91. You look at parents, we've got 570 something parents who are in favor, and then you look over at the orange and yellow, and then look down at the bottom, and we're within tenths of a point in some cases of a 50-50 split of people that are comfortable and want them and those that don't. And the question was, how do you feel about students and staff being required to wear masks during the school day? Let's take a look at the next slide too. So we ended up with this tiered response, and this is, I believe, the key to the whole document. You're going to see that our return to school plan is 60 pages long. But this page toward the front of the report, that summarizes what happens at each level: green, yellow, orange, red. It's been vetted by leadership at Regional West Medical Center. We've had extensive conversations with Dr. Matt Bruner, who's gone through it with me, every single line by line, and believes very strongly that this is what we need to do. Panhandle Public Health Division, very strongly, this is what we need to do. And you saw the Department of Education, the Nebraska Department of Education, that they had face coverings under yellow. It's all when feasible. Can't wear it in PE, you can't wear it in music to play an instrument and sing, you can't wear it when eating and drinking. There's not a compelling need that we see that we think we can get away when kids are outside. We got to give kids frequent breaks. All those things need to be in place. But the cancellation of this past weekend's Western Nebraska All-Star game, and the infection levels and quarantine levels that we've already seen in just limited student activity in the school as this summer has evolved, have given us a taste of what we fear may be the case. And in actuality, based on teenage infections that we read each day in the reports from Panhandle Public Health, we don't know. We don't know what's going to happen. It's a funny thing with this. This is the one thing I've ever done that we don't know the end game. We don't know how this problem is going to get solved. we ideally, if things go well, people will say we were wrong, because we'll move into the fall and the fall will evolve and the infections are down. There's hardly any quarantines. Everything looks quiet. People will say they didn't need to be so careful. That's what we want. I've never done anything before, never been part of a big decision before, where in some way our goal is actually that as this evolves, people are going to say we're wrong. And that would be fantastic, because then we'll all be able to move down to green, move down to minimal, and we can get closer to life that we consider to be more normalized. There's a closer look at green. And again, all this is in the report. We'll toggle through then to yellow, and that's where we're at now. And you see face coverings when feasible, which I've touched on. Physical distancing whenever possible. And you'll see the schools have done quite a bit of work to make that as possible as we can, knowing that in class, we will have students sitting pretty close to how they usually do. We can't get half the kids in classrooms. We don't have empty classrooms. Our schools are pretty full. Limited gatherings, daily screenings and temperature checks. We are also planning to respond to positive cases promptly and carefully, with our health offices and our nurses ramped up to do so, and limit visitations from people into the school. We do those things in yellow, and then our goal is, if we keep doing those things, let's see how quickly we can get down into green, and things can improve for all of us. There you see orange, and that's when we're really going to have to look at alternative scheduling. That's where you've got to reduce the number of students in a building, and pivot to a hybrid model. By the way, I'd like to talk about the hybrid model just a minute. There were things about the spring that went really well, and I've talked with many of you, and in fact, we did a broad-based survey about the springtime and how well things went. Some things went really well, some things didn't go so well, but I'll tell you, one of the things that went the worst was we lost track of kids. Kids disengaged. And I'm sure it's no surprise to you that there were homes where parents were home and able to oversee the process very closely. There were many homes where parents couldn't be home, and kids are kids. And that was the biggest frustration for our teachers, no matter how hard they worked, how many phone calls they would make, how many people we had jumping in to try to help. We know that's not an ideal way to go. So we decided we really wanted to ramp up, first of all our technology and our tools to provide online remote education and move to an extended campus concept. And by that, I mean, we will have dedicated classrooms in our school district, whereby students who are taking offline or classes that are not in the building and are moving to an online environment, there will be expectations that they report to school. It will be a distanced environment, so masks won't be necessary, and it will be a full school day, but it will be totally on a computer. It will be very much individualized, with somebody overseeing the learning and our teachers providing that extended campus online experience. Be very similar, but an improved version of what we did in the spring, but kids are going to have to report to a place. We'll also allow parents who can commit to overseeing the process very closely at home and are keeping their kids at home only because of a proven vulnerability, a documented issue with health, or serious concerns about the vulnerability that they feel coming to school will provide for their family, and work with us in an individualized manner, and commit to overseeing their students' learning on a nearly constant basis during the school day. We'll work with families who want their children to learn from home. But by and large, it will be an in-person, in-school model that we hope numbers will be small enough for it to be a full day, and distance appropriately without masks. And we're just going to have to see what our numbers are. This week, we're sending out important surveys to all parents and all staff, asking for your intentions when school opens. Now that our report is out there, we're going to only give people about a week to fill out those surveys, because then we've got to see where we're at. How many families want their kids to learn remotely, and how many staff, for individual reasons, are unable to return to work. Once we have those numbers, we'll be able to fine-tune that plan. That's where we're at right now. I know that seems very broad, but we're finalizing details of it. The important takeaway from that is there will be a quality extended campus experience. For most, it will be in a school building that's distanced, without masks, that will also accommodate students who just cannot do masks, or they don't want to do masks. We don't want that to be a ticket home for the year. That doesn't mean you get to spend your time at home and potentially sleeping in, or playing video games, or just trying to disappear. We don't want kids to avoid masks and choose that option. If they do, they'll still need to come to school. We will find a way for them to come to school, be distanced, learn through this hybrid model where they will be online for a school day. It's not punishment, but it's a reasonable, rigorous alternative that we feel will help deliver instruction and achieve learning as it should be done. Let's move on to the next slide very quickly. Red severe, that's where we don't want to go, and you see where that is. We can move on from that. Quarantine is a big factor, and that's the last major topic that I want to talk about with you today. This is virtually direct quotes from our PPHD and our Regional West consultants. The chances of a student or staff member being quarantined are significantly reduced if all involved are wearing masks. If either party is not, the infected party or the potential contact, that's not enough. Both people need to wear masks. And for those of you who say, why don't you just give people a choice? The problem is, if you choose not to wear a mask, you're making a choice not only for yourself, but as we all know, you're making a decision for that other person too. It's such a strange, unique situation where you can see we're doing so much to try to achieve choice for people. But in this particular case, you provide choice, and we all came to consensus virtually unanimously that if we don't bring masks in, quarantines are going to kill us. And I can't even count how many quarantines we've already had between weight training, volleyball, football, and associated activities with a small percentage of our kids involved. Because any student that spends more than 15 minutes with another student and they're not both wearing masks is quarantined. We'll extend that for a whole school day. Now, we don't decide the quarantines, you know. That's not our decision by any means. That's Panhandle Public Health. That's the state. So picture a kid in high school through 7 periods a day. And every period, they are sitting with 3 across the front, 3 behind them, and 1 on either side. That's 8 kids that are within 6 feet for 15 minutes or more. Times 7 periods in a school day, how many kids are going to be ultimately quarantined for 10 days, as many as 14, and then they can come back and be back for 2 days or a day, and the same thing happens and they're gone again. And what happens to those students? And that's the quandary we kept facing all the time. How do we get around this? That's why you'll see it at the high school, for example, they're moving to a block. At least if something happens, it's 4 periods a day rather than twice that. Less contacts will mean less quarantines. So we've had to make compromises that we think are reasonable and prudent to get through this thing, and that's quarantines. So bottom line, we end up with 3 choices. First one, we live with ongoing quarantines. We roll the dice. And we don't do masks. We don't do some of the more intrusive precautions. And we just see what happens. We've seen already, and we have good reason to believe, it's not going to work. And when the State Department of Education and our local medical experts are telling us use masks, that's really important when you blend that with the issue. Number 2, We wear a mask, we take temperatures, and we implement the recommend prudent measures to avoid number one. Number three, and more people than you'd think supported this, but we made a decision we don't want to go there, and that's split schedule. That's where half the kids go on 3 days a week, half the kids go on 2 half days, things like that. That's an orange. That's a place to go if things move up to scale. Maybe we don't like it. We decided to provide a buffed up, hybrid, remote, online, extended campus experience for kids as an option for individual students who believe that number two, either believe number two is not something they're comfortable with, or that they're still concerned or have vulnerabilities at home or with students themselves. And there's quite a few. The surveys show there's far more than you would think, both staff and students, who have conditions that put them significantly at risk according to the medical standards that have been established. This you can read in the report, but wanted to give you an idea that it's summarized in the report. Melissa Price made this all an online document, so there are even tabs that you can click onto. So if you want to see what's happening at Bluffs Middle School, the high school, the elementary schools, if you want to see what operations look like, facilities, curriculum and instruction, health and wellness, you click on the tab, it's hyperlinked, it'll take you right to that section. So you don't have to read through the whole 60 pages. It's even going to be bigger by the time we have the introduction pieces, but you get the idea. You can read it all through closely, or you can skip to a section that's most relevant for you. Again, in closing, this is the summary. This is where it all comes to a head: the green, yellow, orange, and red, and then the blue enhancements that you saw on the previous page that are there for every student that we're taking precautions with. You'll see, for example, the plastic sneeze guards, like you see in the grocery stores, are in some of our key reception areas. You'll see some tighter restrictions for visitors. You'll see the temperature screening. You will see ramped up disinfection and cleaning procedures that are in place in all our classrooms and all of our schools. You'll see distancing in place whenever we can do it. That's for all kids all the time. And then you'll see what's specific to each of the risk levels as well in some detail in the report. As we look ahead, we're just going to have to work with each other. None of this is pleasant for any of us, but we're all trying to get in the same direction. I want you to know that as superintendent of schools, my responsibility was to make sure there were lots of voices in the process. And with nearly 100 people participating in our committees, with the parent focus groups, the staff focus groups, the extensive survey data we collected, the consultation with outside entities, I believe the process has been very thorough and thoughtful, and we've landed in a place that the umbrella team, that's the group of each of the department managers, principal representatives, and central district office administrators, that group of about 14 people, before we move forward, they needed to reach consensus, if not unanimity, on everything that was decided. And we discussed these findings in some detail with staff during our focus groups as well. So here we sit. I feel very good about what we're doing. I think we're modeling the right thing for this region, for this area. I think we're taking very seriously the role we have in the economy and the role that we have in keeping our students and our staff and our families healthy. Thanks for spending the time watching this. I hope you'll be able to spend quite a bit more time even reading over the plan, and most of all, I hope you'll work with us, and I know you will support us. You do in everything we do. I know you'll challenge, I know you'll question, and I know there'll be some who'll grumble. Absolutely, there will. We knew no matter what we decided that would happen. But I hope at least you know we thought about it. We took it seriously. We spent a lot of time. We asked questions. We were open-minded. And even then, the decision we're making, we're hoping will get us through the first 6 weeks of school, and will allow even some flexibility in the elementary schools for our younger kids, depending upon what our elementary school communities decide and what the data shows us as we move through Labor Day. That'll give us a chance for more conversations, but we've closed our minds to nothing, and we want to keep our minds open as we move forward. And I hope we can all come together to make this work and be successful, keep our kids in school, learning, and safe. Thanks very much.